Welcome to our channel. Today we're talking about an important topic for all cat owners. When to take your cat to the vet. Look, I get it, cats are masters at hiding their pain. In the wild, any sign of weakness makes them vulnerable. But that instinct to mask their discomfort can make it tricky for us, their guardians, to know when something is seriously wrong. That's why we're going to equip you with the knowledge to decipher those subtle cues your cat might be sending you. We're diving deep into the warning signs you should never ignore, so you can be your cat's best advocate and get them the help they need when they need it. Because trust me, a trip to the vet can mean the difference between a minor hiccup and a major health crisis for your furry friend. Let's dive into the warning signs you should never ignore. Alright, let's talk about your cat's inner Garfield. You know, that insatiable appetite that seems to defy the laws of physics? Well, if your furry little Hoover suddenly loses interest in food, or even worse, goes on a hunger strike, that's a big red flag, folks. We're not talking about skipping a meal or two here. I mean, a significant decrease in their usual food intake. On the flip side, if your cat suddenly starts channeling their inner glutton and can't seem to get enough food, that's equally concerning. Along with appetite changes, keep a close eye on their weight. Unexplained weight loss or gain can be a sign of serious underlying health problems, from dental disease to hyperthyroidism to something even more serious. Remember, cats are masters at hiding pain and illness. So if you notice any drastic changes in their eating habits or waistline, don't wait. Get them to the vet as soon as possible. Early detection is key when it comes to treating any potential health issues. Cats are creatures of habit. They thrive on routine. So when their behavior suddenly changes, it's a sure sign that something is off. Maybe your usually affectionate cuddlebug has become withdrawn and distant, hiding away in the dark corners of your home. Or perhaps your typically mellow feline has transformed into a tiny, hissing ball of fury. These sudden shifts in behavior can be a sign of pain, stress, or even a medical condition. And then there's lethargy. If your cat, who normally bounces off the walls like a furry pinball, suddenly seems low on energy and spends most of their day snoozing, that's a major red flag. Now I know what you're thinking. Jackson, my cat sleeps all day anyway. And you're right, cats do love their naps. But there's a difference between normal cat naps and excessive sleeping, so trust your gut. You know your cat better than anyone. If their behavior seems off, don't hesitate to call your vet. Let's face it, we've all stepped over a hairball or two in our day. It comes with the territory of being a cat parent. And the occasional upset stomach, well, that's just part of life for a curious creature who explores the world with their mouth. But here's the thing. If your cat starts vomiting or having diarrhea frequently, or if it's particularly violent or bloody, that's when you need to sit up and take notice. Frequent or severe vomiting and diarrhea can lead to dehydration and other complications. It's crucial to figure out the root cause, which could be anything from a simple dietary indiscretion to a more serious medical condition. So, if your cat's experiencing tummy troubles that are more than just a passing thing, don't delay. Get them to the vet for a checkup. Breathing problems in cats are nothing to mess around with. If you notice your cat coughing, sneezing more than usual, or struggling to catch their breath, these are signs of a potential respiratory issue that needs immediate attention. Think of it like this. You know that feeling when you have a cold and you just can't seem to get enough air? Well, imagine how much scarier that must be for a little cat who doesn't understand what's happening. It's our job to be their voice, their advocates. Respiratory infections, asthma, even heart problems can cause these symptoms. And trust me, you don't want to wait until it becomes a full-blown crisis. So, if you notice any signs of respiratory distress in your cat, don't hesitate, don't second-guess yourself. Get them to the vet or an emergency animal hospital right away. Let's talk about the dreaded litter box, that magical rectangle that can sometimes feel like a minefield. Now, we all know cats can be a bit finicky about their bathroom habits, but changes in their urination or defecation patterns are a major red flag. If your cat is straining to pee, crying out in pain, or you notice blood in their urine, these are signs of a potential urinary tract infection, or even worse, a blockage, which can be life-threatening. Similarly, changes in their pooping habits like constipation, diarrhea, or blood in their stool are also cause for concern. And if your cat suddenly stops using the litter box altogether, consider it a 5-alarm fire. These changes can indicate a whole host of medical issues, from bladder stones to kidney problems to behavioral issues. So, Pay attention to what's going on in that litter box, folks. It can tell you a lot about your cat's health. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more pet care tips. And remember, when in doubt, always consult your vet. See you next time.